Hello, it's Tammy. I had a couple of thoughts because I've been interacting with some people recently, and it's really kind of speaking loud to me at this point. And that is I want to talk about integration and what exactly I mean when I say I like to integrate the work that I do with what other people do. Uh, this isn't about an either or, and one of the things I've recognized in our society is that it's very much either or. Either we are all medical or we are into alternative. I do realize there are people who are wanting to do both, but yet at the same time they're experiencing not the results that they want to get. And so it becomes questionable as to which one we do. And of course, when our health is on the line, we want to choose the ones that are going to be the most effective for us. Interestingly enough, I work, like I said before, in the Amish community. I work in both worlds, and one of the interesting things to me is a lot of people that I know on the outside of the Amish community, otherwise known as the English. The Amish, let me back up. My friends and colleagues often think that the Amish are very much into holistic health and, very, very appreciative of alternative, aka complementary care. And that's not necessarily the case. It really depends on the family. It depends really where they're located, and more importantly, just really where their family. They are collectively, they will get involved with direct marketing, and of course that it does involve a lot of herbals and oils, and especially supplements. But it really depends on whether or not they're going to go either way. And so what I'm getting at is that oftentimes they are very medically oriented. And what I found interesting, and this is where it really kind of screamed rather loud to me, which is when they're medically oriented, they kind of cringe when I come around because they're afraid I'm going to tell them not to do the medical. I even see this in their dental work. They want to. They're very much either or. The same thing goes if they're completely complementary. They're afraid that, they're so afraid, and they will do so much because they want to avoid the medical world. And I frequently spend a lot of my time in their homes explaining how the two worlds really do need to come together. And we need to do it in a way that complements the treatment, as well as complements the body and addresses the body on an individual basis. The same thing comes up for that matter, in any situation. I've personally have experienced it in the medical setting. I've worked within treatment facilities. I've worked with PTSD, DID, which is dissociative identity disorder. I've worked with autism hands-on. I continue to work with autism and addiction, when that addiction was also in the treatment facility, as well as eating disorders. Self-harm was another one. So there's a lot of mental, emotional concerns that people have, and they will turn to the medical world for assistance, and then they try to complement it with a supplement and or oil or herb. And like I said, they're never sure if it's working or not. And so when I suggest to include what I do and what I did and how this started, because I'm not going to deny it, I have had the same thoughts. I mean, I started out in the pharmaceutical world. I was working in pharmacology and developed a strong interest, or always had a strong interest in plants. But once I was introduced to essential oils through a professional nose who actually worked for IFF initially, and then she went on her own. She was a professional nose. She went on her own to start designing natural fragrances, and that's when I met her and we paired up. That was the beginning of how all of this transcended for me. And there was a time that I completely pushed away the medical world because I believed that they were not doing us any good. And if we could do a natural way, then we were best advised to do that. Well, I've come to find out that that's not necessarily the case. And this is where the integration comes in. So as I mentioned earlier, with regards to addiction or DID or autism or schizophrenia, even for that matter, autoimmune disorders, even if you're just taking, you have chronic health conditions that require medications on an ongoing basis, to incorporate very specific essential oil blends and very intentional nutritional suggestions, in addition to everything else, actually allows your body to incorporate and integrate everything that you're doing. Let me give you an example. So, the first one I'm going to use, the first example will be in place of with autism and dissociative disorder. When these folks get completely stressed out, or they're overstimulated, or they have a flashback, you can actually utilize specific essential oils that are just custom made for that particular individual, and actually call them back into the present moment, actually help them find a way to soothe. So like I said, with dissociative disorder, there was times where we had people would go into a flashback, and when they're in a flashback, they're experiencing everything. They hear, they see, they smell, and they feel everything that occurred at that moment of trauma. And one of the most effective ways to bring them back, and I know there's other tactile treatment or processes that you can go through, but the sense of smell is one of our most primitive senses. Our nose is a direct extension of the brain, and you can actually represence someone into this moment rather rapidly with the use of a very specific essential oil. The same thing can be done with autism. When these children are, or for that matter, anyone, as an adult, I've seen this time and time again, and some of the therapists that I've been interacting with have commented to me about a lot of their people are very smell oriented. And if we play on that, if we actually rely on that sense, we can assist them if they are overstimulated, or if they are understimulated and needing to stim them, to regulate their sensory their sensory activity. You can do this very effectively through the sense of smell. The same thing can be done for addiction. Again, with addiction, even though there is a biochemical reaction that occurs in the body, there's also a behavior, and there's also as well as psychological, as well as environmental. And if you can get somebody to, even through the sense of smell, recalculate, if you will, their environment and bring them back into this moment, the potential for offsetting a relapse while they're in recovery would be tremendous. When it comes to somebody who's dealing with chronic health issues and they're on a regimen of medication, I had a client the other day in his 70s who is struggling with insomnia. He has a history of stroke. He has diabetes, and he also has urinary spasms. I guess in the bladder, there's bladder spasms. I was just thinking there's urinary tract issues, but it's actually like bladder spasms. So when he's on quite the cocktail. He's got 9 medications, and when I did all the research on the medications and identified what was being affected by his body, what was going to be contraindicated, whether it be nutritional and or other medications, I'm paying attention to the chemistry that they're talking about, and realized that the only way that I could help, my immediate sense was I knew how I wanted to help him get off to sleep, which was with the regulation of neurotransmitters, and yet based on the way the medications were working in the body, it was not recommended to go that route. So I went a different way with him to actually help his body actually utilize carbohydrates, fats, and proteins in a better way, because when he already is diabetic, and when the carbs aren't being assimilated on a cellular level, it will contribute to blood sugar problems, which will offset and create high cortisol and can potentially cause insomnia. So we went, like I said, we went about it a couple of different ways, in opposition to what his medications were doing, but not in opposition to counter them, but actually to support them. Again, integrating the medications that he's using so that he actually gets a more benefit out of the medications. And this is the whole point to integration. When I work with autism, it's not about, a holistic or alternative or essential oils, for that matter, is the answer. It takes an integration of the work. I've had plenty of therapists didn't want to include the oils, and I've had doctors feel almost threatened because they thought I was trying to come against them, and the fact of the matter is, I'm not. I'm trying to help regulate the neuroendocrine system so that the child or the adult can better integrate the therapy that they're doing, and as well as integrate what they're sensing in order to interact on their level. This isn't about changing anyone to be what we think they should be. This is about helping others integrate how they're feeling in order to be able to interact with those of us who are not struggling. And I beg to differ with that last statement, because in my world and from what I can see, many people are struggling. There's a countless amount of stress, a need to feel like we need to fit in. We're struggling to adapt to our environments for whatever reasons. And of course, there's also a lot of health issues. But all of those, and on top of the environmental toxins that we're exposed to, whether it be in our foods and or in the air, these things are all factoring in, and they are affecting with the way we interact with each other emotionally. And so helping, and that's just it. People who are extra sensitive, which it could be schizophrenia, it could be autism, it could be you, and you may not even have a diagnosis of any sort. You just have a sensitivity. You feel the world around you. You walk into a room, there's been an argument, you can sense it. You might be sensitive to sound, light, wind. It doesn't make any difference, but that little bit of aggravation will trigger the autonomic nervous system to flare. And at that point, you will have a struggle to interact with those around you. Again, you might feel when somebody's sad. You also can sense when somebody's happy. Think about it. Think about how contagious joy and enthusiasm. If you go sit and watch a child, how many times have you watched a video of a child just laughing, and you can relate, you can connect to that, and it puts a smile on your face. Or for that matter, when we watch animals. So these are how we are adapting, and we're not even giving ourselves credit how in touch we are with the environment around us. And so through the use of very specific, I'm using that intentionally. It's got to be specific, because there's no one size fits all. You cannot possibly go into a book and recognize that this is what you need. These plants have amazing qualities, but there is not only is there a biological component or a chemical component within the plant, there is also a physiological effect within the body. So 1 oil, 2 oils, 5 oils, 10 oils may all have very similar biological qualities, properties that are been noted in the human body, but they're going to affect each one of us differently based on our own biology, chemistry, physiology. And one last point I want to make here is the reason I push plants and why they are my muse is because Plants are adapting to the environment much faster than we are adapting to our environment. They have a very instinctual ability to regulate themselves and rewrite their own wiring in order to protect themselves. I've said this to a number of people. These plants that we are surrounded by are they're exposed to the same microbes that we are. It could be, any virus, spirochete, bacteria, fungus. I mean, they are everywhere. And so these plants are exposed to the very same thing, but they're not getting sick with it. They're not losing their lives over it. And yet we are being triggered by it. And again, I've mentioned this before, our immune systems are very unique. They are as unique as our fingerprints. And this has been recognized in a number of studies. It is also the most effective, or adapted, I prefer that term, the most adapted genetic complex on the planet. And for that reason, our immune systems are as unique as our fingerprints. And for that reason, everyone's immune system is going to be reacting differently to the environment. So, handpicking very specific plants that will work with what's going on with the individual, and this takes time. This takes time to understand how all of this works, and this is the reason why it's really a good idea to find outside support in order to assist you, whether it be through consultation or actually providing you with the product. On that note, products are very important. Where these plants are being grown is incredibly important. If they're grown in their native lands, they're better adapted to the environment. If we bring them into and try to farm them separately or outside of their natural environment, you're going to have a different quality of oils and plants. So it's very important to know the origin as well as the quality. There's no such thing as a therapeutic grade. That is a marketing term. That is not a requirement of anything. We have genuine and authentic essential oils, which is what we need to be looking for. We want to look for, wild crafted plants. If they're going to be farm raised, they need to be organic. These are very important qualities to our plants, because at that point they're better adapted to the environment, and they're more better equipped to handle our responses to the environment. So that is what integration is. I got off on a little side note there. But integration really is about incorporating everything and hand selecting very specific plants that will assist with the integration of the medical world. Because these two worlds are meant to work together. They're not meant to be independent of one another. While some people can do well one without the other, depending on, I'm going to say this, depending on the needs of the individual, there may be exceptions to that rule, where just maybe natural solutions are the remedy of choice. But when it gets into more concerns, where you've got a serious infection or you've got a serious health condition that requires medical assistance, the inclusion of both is very beneficial. And again, on the note of mental health, this work is magnificent. Whether someone's doing pharmacotherapy or not, it is a very beneficial step to actually helping to regulate and assisting that person to really better integrate the work that they're doing with all of these therapists, because these therapists are doing a world of good for our friends and family. And just allowing these people that we know and love to better integrate the work that they're doing is going to be a very powerful gift that we can give. So until then, thanks for watching. Please contact me, Tammy.Davis8 @gmail.com. That is Tammy.Davis8 @gmail.com. I look forward to hearing from you, and until later, have an absolutely beautiful afternoon. Bye now.